Hi, my name is Dr. Karim Dhanani. I'm a naturopathic physician from Toronto, Canada. I've been in practice for over 20 years. Most of my practice has been from Toronto. I decided to focus on chronic disease, and I've been doing this with the most amount of attention to detail as possible. So I've been seeing patients for just about 21 years. So I've decided to focus my practice not on acute medicine. I focus my practice on chronic diseases. And the reason why I focus on chronic diseases is because if we draw a comparative to trauma medicine, to acute medicine, to hospital medicine, if you get hit by a bus, for example, I'm going to go straight to emergency. And they do an incredible job. They focus on surgery, they focus on extreme pain management, they even focus on acute exacerbations of chronic disease, and I think they do a lovely job. The problem that I find is with our medical system is when you try to take those acute therapies, which are exquisite in a hospital setting, and you try to move those ideas and that philosophical framework over into chronic disease. Chronic disease is not acute medicine. Chronic disease takes many, many years, dare I say decades, to develop. You cannot take these ideas or these therapies and push it onto this. So I use a different mechanism of diagnostics and a different mechanisms of treatments than I have for acute disease. I use different diagnostics in my office, and I use different treatment mechanisms in my office. So I focus specifically on chronic disease. The majority of those diseases, because they're chronic diseases, they seem to have had a detrimental effect on the autonomic nervous system. And so trying to have an impact on the disease process without addressing somehow the autonomic nervous system, you're almost doing a disservice to your patients. You want to treat the chronic disease, of course, but you also must balance the autonomic nervous system, not only because it will give you better successes, but your long-term capacity for patient success is so much better, because those patients will not relapse once their autonomic nervous system is in balance. There's an incredible opportunity. You know, we seem to double our knowledge in science every 5 years. And I think that there's an opportunity here for Nesa. I think we keep focusing on the top-down approach, and I think we have been doing this for the last 7 or 8 years with moderate success. But we need to focus on the feedback mechanism of the autonomic nervous system, and I think that's where Nesa can really stand apart from everything else, because you're looking at all of the terminal branches and you're giving a feedback to the vagus nerve. And that's a different way of looking at things, and I think it's a brilliant way of looking at things. And so I'm excited for the opportunity for Nesa in the future, for sure.